Well, good afternoon. We're joined by three special guests. Of course, Chief Craig and Denise Fair, our health director, and a special guest joining us from Hong Kong, Joe Tsai, the vice chairman of Alibaba, and a good friend of the city of Detroit. In June of 2017, Alibaba did their first U.S. conference. And for those who aren't familiar, Joe might say this is a simplification, but for the average American, Alibaba is the Amazon of China. And it's an extraordinarily successful company. And when Jack Ma, the chair, and Joe decided to pick one place in America to hold their first conference, they picked the city of Detroit. They had 3,000 entrepreneurs, and I got to kick off that event. And their message to Detroiters and to all of their entrepreneurs was this: you're making money selling on the internet, selling your products, your services on Amazon. There is an entirely different market in China. And your business can get bigger. You can hire more people if you learn about it. And they held the conference here, and it was a remarkable commitment, I thought, by Alibaba to the city of Detroit, and a great vote of confidence in the entrepreneurial spirit. And Joe himself has a pretty remarkable record. Aside from being a Yale student, he was a varsity lacrosse player for 4 years. And in addition to running Alibaba, he owns the Brooklyn Nets basketball team in his spare time. And he came back and said, we're staying connected to Detroit. And the Joe and Clara Tsai Foundation said, how can we help? And I said, the biggest thing we need right now is PPE. And Joe didn't do anything small. He said, how about if I send you 350,000 masks and 100,000 goggles, which allows us to help with our first responders, our police and fire, the people riding on the buses. It's also going to help with a lot of small entrepreneurs, because by now the big hospitals and the major companies have found a way to get PPE. It's a lot of the small players that can't do it. And this is going to allow us, with some of our small contractors, as we announced yesterday, a lot of our small grocery stores, this is going to help the small business community. And when you couple the free testing we're doing at the fairgrounds with the ability to distribute masks and goggles, this is going to be a big part of restarting our economy. And to give you an indication of his commitment, it is 2 a.m. in Hong Kong. And so here, by the wonders of the internet, I'd like to turn it over to this very generous man, Joe Tsai.
Yeah, Mayor Duggan, thank you so much. You talk about the internet. This is where the magic happens, right? Remotely, thousands of miles away, and time zone difference. And as you mentioned, my wife and I have been, been living this pandemic, and we asked ourselves, what are the cities that are hardest hit in America? As you know, with the Brooklyn Nets in New York City, we did some help with the PPE in New York. We also decided that Detroit, one of the hardest hit places, with the number of cases and also fatality rates that are pretty high, we thought that this is something that we wanted to do. I think one thing that we kind of discovered is in Detroit, the fatalities tend to skew toward the elderly, the people that are in the nursing homes, and also the minority, the African American community. This is something that we are very, very focused on. And thank you for the opportunity. We reached out to your office and said, hey, let's make a PPE donation. And you were very, very helpful in directing us to where the materials and supplies are most needed. You talked about the first responders, fire and police, transport, but also testing centers are getting this PPE. So I'm very glad to partner with your office. And the other thing is, we also, as part of this effort, the Detroit Pistons organization, because we're part of the Brotherly League of the NBA, we compete on the court, but off the court, we try to find opportunities to work together as much as possible. So the Pistons organization are helping to transport the supplies In fact, the supplies arrived from China into Chicago a few days ago. So they're taking their trucks to haul that into Detroit. And then by next Monday, they will be distributing the materials to the various organizations where the materials are needed. So I have a very fond memory of Detroit. As you mentioned, in 2017, Alibaba held a small business conference, and the idea back then was that we would like to find out whether there are American small businesses that are interested in doing business on our platform that sell to China. We have a wholesale platform because the import-export logistics are quite complicated. So we are trying to find small businesses that will sell in a wholesale manner. It's a global platform, one of the world's largest. It's currently doing about $10 billion a year in global trade. And so what we found was that there was a great deal of interest among the small businesses here in America. And we chose Detroit to be the place because Detroit really represents that rugged small business character. And you helped out, and we had a very great conference. I still remember my wife and I had dinner at the Selden Standard, and then she wanted to go to the Avalon Bakery to buy some bread. These are small businesses that are I understand that the bakery is closed right now to walk-in stores, but I hope they do delivery and they could still support, and they also need support. So a lot of small businesses in this environment need support. So we, since then, we did a lot of work to set up specifically an operation, a team in the United States to support small businesses and to enable them to come onto our platform to sell around the world. It's a complicated thing because it's import-export, so most small businesses are not familiar with it. So we have a team of people that do that. We launched the platform for U.S. small businesses last year, and now we have over 1,000 U.S. small businesses that are selling on our platform. We also have some larger companies like Office Depot that have a presence because they are servicing the small businesses. So we're very, very excited about this platform, and this is an opportunity that we're thinking that we could partner with Detroit again, partner with you to try to further our small business efforts. And I look forward to having a discussion with you about the various initiatives that we have in mind.
Well, thank you. And for the Detroiters watching, this is a reminder of how important Detroit's become to the world in recent years. Last week, we had the CEO of Goldman Sachs on talking about a loan program that they started here. They felt Detroit was important enough. And now you got one of the world's great companies, Alibaba, doing this as well. Normally, we go through a whole presentation and take questions at the end, but in deference to the fact that Joe stayed up till 2 in the morning, we're going to stop this and take questions for him. So any media with questions for Joe Tsai, and most of them will be remotely because they aren't coming out and joining us in groups, but John will tell us if we have any questions.
Mr. Tsai, Crane's Detroit Business had a question in follow-up to the 2017 conference that you had, where I believe it was discussed that the possibility of having Detroit as a distribution hub. And they wanted to know, is there any progress been made on that, and what's the status of that?
I didn't even put him up to that.
Yeah. I think Detroit is very centrally located. We're still evaluating the possibility. I think for a city or a place to be a distribution hub, you need to have the scale of business activity. And right now, we've got about 1,000 U.S. small businesses that are trading on our platform. We hope to add more. So as we see the businesses and the activities, transaction activities scaling up, we would certainly consider that as a possibility.
Okay, and outside of the distribution hub, how do you see Alibaba's relationship with the small business community in Detroit going forward?
Well, I mentioned that Detroit is a city with grit. It's a rugged city, sort of have that character, and small businesses. Alibaba's roots are helping small businesses for 20 years since we were founded. That's our focus. So what we've learned is that small businesses are very resilient. They may suffer, at the front end of suffering when something like economic crisis or something like a pandemic hits, but they also are the most flexible in coming back. They're very resilient. So this is kind of our DNA, is to help small business. So I think Detroit, is not just the small businesses in Detroit, but Detroit is also a hub for us to think about how to leverage the resources here to help all of the small businesses in the Midwestern states, in all America.
Switching gears a little bit, questions from WWJ Radio here in Detroit. Reporter John Hewitt would like to know how you see the next season for the basketball, for the NBA, and what that looks like. Do you envision playing in empty arenas if needed, or what are your thoughts on that?
I think it's a question that's more appropriate for Adam Silver, because he's thinking about the not just next season, but how about the current season? Because we're only 3 quarters into the current season. But the answer is there hasn't been an answer because we are watching the data. What's I think also in the mayor's office is very focused on the data. You can't just pick a date and say a certain date we have to come back. You really have to see the cases flatten. The hospital systems have the capacity to handle all the cases, and also the complexity is that in America there are different states, state by state, city by city. There are different stats and different fatality rates, case rates, and the league is 30 teams in so many different cities and states. So are we going to have some kind of uniformity when we do come back? These are some of the complex questions that we're facing. And I think not just the NBA, but, Major League Baseball, NFL, all looking at this. But certainly the possibility that playing fanless is a possibility, because, the important thing is we want to make sure that, number one, our players that actually play the game are going to be protected. They're healthy and safe. And also that the fans are protected. So we're certainly not going to put 15,000 people into an arena without social distancing if there's still a risk that the virus can spread. One of the most pernicious things about the virus is that you could be perfectly healthy looking, but you're a carrier, you're asymptomatic, and therefore you're contagious. And that's something that we need to address.
Okay, and last question for Mr. Tsai right now is, can you talk just a little bit more about how this partnership came together with the Nets and the Pistons to provide this PPE for Detroit?
So the Pistons organization, we're kind of a new ownership group coming into the Nets. I bought the Nets last year, having made a minority investment a couple years prior to that. So we're just still feeling our way around, with all the different ownership groups. But obviously we're all in the Eastern Conference. Played Detroit many, many times. They always played us tough. So we, when my wife and I, Clara and I, decided to make the donation, besides working with the mayor's office, one of the first things was reaching out to Tom Gores and his team. I remember on a few days ago when I arrived back in Hong Kong, at the Hong Kong airport, I had a call with Arn Tellum, who is running the day-to-day of the Detroit Pistons. They readily agreed. I mean, they didn't hesitate. When I called, I said, look, I need you guys' help because you're the hometown team, and maybe on the logistics front, you can help us out a little bit. And they without hesitation, Arn said, absolutely, I wanted to do it. And that's how the partnership came together. It came together very fast in a very short period of time, but I really appreciate them stepping forward, really taking on the responsibility. It's great. It's a great sort of camaraderie among all the NBA teams that we can do this for the city.
Thank you very much.
Well, Joe, thank you very much. You were more than kind to stay up late for us. And I want you to know, since you were here last, we're putting significant investment into City Airport as a distribution hub. So when things ease up a little bit, I'm going to be looking forward to continuing to talk about Alibaba's future in the city of Detroit. Thank you very much.
Thank you very much, Mayor Duggan. Speak to you soon.
All right.
Thanks.
Take care.
Be safe. Thanks.
So it has been remarkable in this city, the way people from around the country have pitched in, and it's been very rewarding. We're continuing to shift to how we operate for the months to come, and I'm going to talk a little bit about the numbers we have today. It's, what is it, 1,036?
Yes. Yes, that's correct.
1,036 deaths reported today, up from 1,008, but 2/3 of those were dated from a while ago. So I'm going to come back to this chart. We're just going to continue to post it on our website now, because I think it's the best indication of what is happening. And these are the daily deaths in the city of Detroit. And again, we're looking at them now at a week at a time. So 3 weeks ago, we had 248 that we lost. 2 weeks ago, 271. Last week, 192. And in the past 7 days, only 92. We continue to be probably as much as any city in America. We went up very fast. We flattened faster than pretty much anybody. And we are now dropping. But it does have some implications that I want to talk about, particularly with our healthcare system. Today, the Detroit hospitals have 700 empty beds, adult beds, and another 100 empty ICU beds. That was inconceivable a couple of weeks ago, but we need to talk about what we're doing with the healthcare system in the city overall. But to give you a sense of how this happened. So on March 23rd, over here, we lost 6 people. And by March 24th, it had doubled to 11. That was the beginning of this rise. On March 24th was the day the governor put her first shelter-in-place order. It was right here on March 24th. We went up till April 1st from 6 to 11 to 44. It was remarkable how fast we had taken off. And at 44 deaths, right here about the day before, the federal government and the state announced they were going to build out 1,000 beds at the TCF Center. We were doubling the number of deaths every 2 or 3 days. Had we doubled one more time in another 3 days, we'd have been way off this chart by April 4th. And when the feds and the state decided to build a field hospital, that's what it looked like was going to happen. It looked that way to all of us. It looked like that way to Chief Craig, who was himself sick, along with 600 quarantine officers. At the time, we didn't have tests, so we didn't know who was sick and who wasn't, so we quarantined 600 people when probably 100 had the virus. But because of the testing and because the people of this city backed the social distancing order in such a dramatic way, really, I believe, faster than anybody in the country, we hit April 1st when everybody else was still going up for another week or 10 days. We leveled off. And we basically plateaued from the 1st of April to the 17th of April. And you remember when I said we'll be judged how well we did by how many beds I used at the TCF Center. I told you I thought we could hold it down to 200 or 250. We might not need all 1,000. Today there's 12. They've never gotten above 16. That's why the federal government keeps citing Detroit's success. But since then, we are steadily coming down. If we keep doing what we're doing, every day's conversation is going to be more and more about what we can restart. The one thing, though, that I'm really calling on the governor and our hospitals and our doctors to work on is opening up the rest of the medical system. Having 700 empty beds is something we never saw in this city in a normal year. And what is really concerning to me is I think the day-to-day health care of a lot of Detroiters is being neglected. The governor has a task force now on disparities in health care, and that's a good thing. But the black and white health care disparity in this country didn't start with COVID-19. It's been here for a long time. And when you can't get into your doctor or you can't get into your hospital, the disparity gets even worse. We have people in Detroit today who are not getting their sickle cell treatment because they don't want to go into the doctor or the hospital. We got people who aren't going to the doctor to take care of their diabetes. We've got people with heart issues who have not gone in for angioplasty. We've got people who have been told you've got a lump and they haven't gone in to get a biopsy for their cancer. What is happening right now is when you cannot get to your doctor, the health disparities between the black and the white communities get worse. And when we were up here and our hospitals had people on gurneys in the hallway, we had nurses and doctors who didn't have the masks, who were getting sick because we didn't have the protective equipment. You wanted to stay away. It made sense to defer your health care when you were up here because your risk of getting worse with COVID-19 was probably worse than not having what's called elective surgery. And in my mind, elective surgery is facelifts and cosmetic surgery. Everything else that they're doing, angioplasty is not elective surgery. You may not need it today, but if you don't get it, you are going to be at risk. Now that we are coming down, we need the people of the city, the doctors, the hospital, and the governor to move quickly to open up medical care. You need to get to your doctor if you've got the chronic conditions, whether it's kidney or asthma or heart, high blood pressure, things that you day in and day out need to maintain. It's time to call your doctor and start to get the treatments again. Commissioner Eric Jones tells me that we have a rise in the number of people who, when the EMS arrives, are people who are dead on site, who have nothing to do with COVID-19. Now, at some point, the doctors will analyze this, but I suspect we have people who are deferring their other health care needs in this city. And I want the public to understand, hospitals know how to treat you during times of infectious disease. They know how to segregate wards so that you don't have the infectious with the non-infectious. Hospitals do this all the time. Every year there's flu season. They've got staph infections they have to isolate. They deal with tuberculosis. They deal with HIV. Hospitals and doctors' offices know how to operate under normal circumstances in a way that you can be treated safely and not be subject to infectious disease. They couldn't do it 2 weeks ago when they were overloaded and you didn't know which staff might have been infected, much less which patients. But we're getting to that point, and I'm hoping we will hear announcements from the doctors, from the hospitals, from the governor. I know the governor's already eased this some, and Henry Ford in particular has started to move in the right direction. But I really see the next big health issue in this city being sure that everybody can get in to be taken care of as you were. You need to go back to seeing your doctor for your chronic conditions. And so I know there's a lot of chaos going up in Lansing today, and it's hard to make calm decisions in that environment, but we do need some quick decisions to open up the healthcare system. So that's going to be something I focus on in the next week. The other person who has managed to return operations to normal in a remarkably short period of time is our police chief, James Craig, and I'll let him update you on what's going on in the police department.
Thank you, Mr. Mayor. You know, there is some exciting news to report, but I want to start by saying, you know, the mayor and his leadership, you know, several weeks ago we heard about the rapid test, and he reached out to Abbott Laboratories out in Illinois, and really when I look at a couple of things we've done as an organization very effectively, that rapid testing has just worked remarkably. I mean, in fact, when I was retested after being positive, it was a 10-minute response, and I found out I was okay. And so when you look at our numbers, because early on, we were very aggressive, more than most, when you talk about police agencies quarantining our officers, but we really believe that in part certainly helped limit the number of exposures to our officers. So as of today, I'll give you some numbers. One of the things that we're looking at, so as of today, right now, in the police department, sworn and civilian, there's 69 members who are positive COVID-19. But throughout the testing, there's been a grand total of 299, almost 300 of our members who tested positive. Now, quarantine numbers. You remember just several weeks ago when we were reporting out that there were 500-plus members quarantined, sworn and civilian. As of today, and this is the first time I want to say today that we're below 100, 99 members are quarantined, 76 are sworn, and 23 are civilian. Now, when you go back to when we started the quarantine several weeks ago, 3 or 4 weeks, we quarantined a total of 1,116 members of this organization. So again, the mayor's efforts with the rapid testing, phenomenal. And here's the other good news. Decision's been made. The mayor wanted to make sure that every member of the department has been tested. That's moved along quite well. In fact, by way of example, the 7th, 8th, 9th, 2nd, 12th, 5th precinct, our communications, and our detention center have all been tested. So we're very close to completely testing our organization, and that's good news. So again, we're moving in the right direction. In terms of return to duties, another number I'm very excited about, 1,015 since we started. So no disruption to service. Our commands are fully staffed. Our specialized support units fully staffed. And, I had an opportunity over the last couple of days to go and visit several of the commands out in the neighborhoods, just to meet with the officers to see how they were doing, also to conduct my own inspection relative to PPEs. And I will tell you, everyone was wearing their mask in and out of the station. I must have went in 4 stations yesterday, 4 the day prior. Every time I went into the station, upon my arrival and departure, they checked my temperature. That's something else that was put in place that has worked very well. So the organization has really taken the safety precautions very seriously. In terms of morale, I will tell you, our police officers are engaged. They're not complaining. Certainly having a conversation with union leadership, with a few exceptions. The vast majority of the men and women who are out here in the midst of this very critical situation are really happy to be there, happy to be supporting the community, and certainly their colleagues that they work with each and every day. So that's the good news I wanted to report, and certainly at the appropriate time I'll take any questions that you might have.
Right, and now I'm going to turn it over to the person who is totally immersed in protecting our most vulnerable, our senior citizens, Denise Fair.
Thank you, Mayor. So today I want to share our progress on our nursing home strategy as well as our long-term care facility strategy. So just to bring everyone up to speed, there are 26 nursing homes in the city of Detroit. Over 10 days, the Detroit Health Department, in partnership with Wayne State, with Henry Ford, and with our city's first responders, we tested all about 2,000 nursing home residents. And so now we're switching gears, and now we're focusing on the staff. So we asked all of the nursing home staff to sign up to be tested at our state fairgrounds by May 11th. I'm glad to report that 24 of the nursing homes have now contacted the state fairgrounds to get tested. There are still 2 more And we remain actively, we're partnering and communicating with the leadership to make sure those nursing homes are registered, again, by May 11th. It's really important to test everyone, and so that is our strategy. Now, in addition to nursing homes, we're going to switch our focus now on long-term care facilities, and those are the adult foster care, assisted living, and group homes. We've identified 37, and we plan to test all of their residents by May the 15th, another aggressive target, but so far we are ahead of schedule. We visited 2 sites yesterday. We visited 4 this morning, and a total of 6 done so far. So again, we are ahead of schedule. The test will be processed right at the State Fair grounds with a quick turnaround of roughly 2 days. So switching gears now to our cases, we are now at 9,036 confirmed COVID cases and 1,036 deaths. Families are facing loss every day due to COVID-19. I too have experienced loss, and my heart is with everyone during this time. As long as COVID-19 remains a threat in our community, we must continue efforts that will further lessen the number of cases right here in Detroit. Again, this is our new normal. We all have to be accountable, and we are. And so I always urge everyone to practice social distancing, making sure you're washing your hands, wearing a mask, and please do stay home. We can beat this. We are beating this. And with that, I'll turn it back over to you, Mayor.
We'll take any questions.
Mr. Mayor, question from Kirk Pinot from Cranes going back to yesterday. You wanted to know if ramping up the construction work here in the city, if you had any concerns that if we hadn't done that as a city, that we might lose construction workers to other states or other cities.
My focus was on you drive in this state without pothole repairs. You take your life into your hands. I wanted to get the road crews out there. We've got water and sewer work. We've dramatically cut the number of water main breaks in this city because Gary Brown and the water department does such a great job. We had to keep that going. We have to get the vacant lots cut in this city, or none of us going to like what is there. So this was just, I wasn't focused on whether we were losing them. I was focused on the fact that these services need to be delivered for city residents. And I believe with the testing we have, we're now testing 1,000, 1,200 people a day. We have enormous testing capacity compared to other areas. I wanted to take advantage of that capacity and bring our workers back and our contractors' workers back safely and quickly. And I think starting Monday, you're going to see a lot of work starting to be done in this city again.
Question from, I think it's WWJ, regarding Wayne County Jail. There have been some reports that indicate high rates of infection. Not certain if how accurate the reports are or aren't, but they wanted to know if you had any particular thoughts or concerns about it.
You would have to talk to the sheriff about that. You might remember 2 weeks ago, we tested all the sheriff's deputies. It was our 50-minute test, and we've offered to Sheriff Napoleon, if he has individual prisoners that he needs a quick test result on so he knows whether to isolate them. We'll do that as well, but you'd have to talk to Sheriff Napoleon and the County Health Department relative to issues beyond that. They're handling that.
Okay. ML Elric would like to know, Mr. Mayor, if you've had conversations with the mayor about the reopening of the medical system, and if so, if you'd share what she said.
Again, I have continual conversations with Dr. Caldoun, and I'm hoping that they will move quickly. There has been an easing, as I said already, and more procedures are being scheduled. But I think it is 50% on the governor. It's 50% on the health providers. It's time for DMC and Henry Ford and St. John's and Trinity and the major doctors' offices in this town to start to communicate to patients what they have done to make them safe. These hospital systems, these healthcare systems know how to separate infectious disease from patient care, and it's time they start communicating that to their patients. They can do it safely, and so this isn't just the governor. This is the two working together, and I've been talking to all of them. They know how I feel. I think they agree with me, and I think you're going to see movement in the next week.
Okay. And last question we have for today also goes to Chief Craig. It's from ML Elric, and he said he's he's heard this. He doesn't know that it's true or not. And he wanted to see if you could shed some light on it. But he'd heard that one of the city facilities where police cars would go to get minor repairs done had not been operating, and that officers were being asked to take cars to local shops, pay for it, and then get reimbursed.
I'm totally unaware of that. That's something we don't encourage. We do have, especially with the temporary shutdown, vehicles that were involved in accidents that are waiting for repair, but going to outside shops, that's not something that I've heard.
No, I've not heard that either. So if you got a specific, we'll follow up on it, but I would be very surprised if that were true.
Okay, that was the last question.
All right, thank you all very much.
Thank you.
怎么又晚了？
这诊所太远了，这里多开几间就好了。
政府里需要有我们的人，需求才会被听到。
哎，你这……哎，你们两个都对，可光说有什么用啊？填好2020年的人口普查，就可以协助公共资金的分配，比如地方医疗、更多的政府席位。想要给自己发声啊，赶紧上网填，打电话也行。
请上2020census.gov 完成普查。